everyone, my name is Nicole Elliott. I'm a nurse here. I work with VNA Care, so thank you to them for having me here. And thank you also to Quincy COA. And I've been a nurse now for about 25 years or so. I've dealt mainly in geriatrics, cardiac, multiple sclerosis, and a little bit of school nursing, and most recently working alongside VNA Care. So I work in a preventative care environment, and today we're going to be talking about shingles. You may have had shingles, or you may have known someone that's had shingles. So today we're going to be talking about the symptoms, the treatment, and the prevention of shingles. So what is shingles? So just a little fun fact, shingles, the word shingles actually derives from the Latin word cingulum, and that means belt or girdle. And it came from that word, because the rash that it produces comes on as like a belt-like or a band-like pattern on your body. And so cingulum means girdle or belt in Latin. That's where the term shingles came from. So it's a painful rash that usually develops on one side of the body. It's on a nerve path, and it's usually on the face or the torso. And the rash consists of blisters, and they typically scab over 7 to 10 days. They clear up within 2 to 4 weeks. However, there's a picture of an example of the rash. However, the pain from shingles, even though the rash clears up, sometimes the discomfort can last several weeks, months, or even long-term years. So these are some of the band-like patterns or the belt-like patterns that shingles takes on as far as wear on the skin. And really where the shingles rash appears depends on what nerve pathway the virus is traveling down. So if you've had the chicken pox, you've had the varicella zoster virus, that virus then becomes dormant on your nerve cells or inside your nerve cells. And your nerve cells are in your brain and in your spinal cord. And what happens essentially is at some point, your immune system can no longer suppress that virus that's been hanging out on your nerve cells. And so it appears later in life, usually as shingles, as this painful rash. So some of the symptoms that come along with shingles are itching, burning, and tingling in the area where the rash will develop. So you may even start to feel some of these symptoms 1 to 5 days before the rash appears. You may also have a fever, headache, chills. Some people have an upset stomach. And as you saw in this previous slide here, sometimes shingles can even affect the eye area. And depending on the severity of the rash, can cause altered vision or a loss of vision if very severe. About 1 in 3 people in the US will develop shingles in their lifetime, and there are about 1 million cases a year of shingles. That's quite a bit. And so if you think about it, if you've had the chicken pox, that's going to be your indicator that you can get shingles. Okay, so all it is that it's whether or not you've had the chicken pox. Anyone who has, like I said, recovered from the chicken pox may get shingles, even in children. However, it's more common in people over 50, and that is because as we age, our immune system tends to decrease in strength, and so eventually that immune system cannot suppress that dormant virus that's been left over from the chicken pox that you may have had when you were a child. It is caused by the same virus. However, it's not called varicella. It's called the herpes zoster virus when it presents as shingles. We talked about this. Your risk increases as you get older, and then There are other conditions that may affect your immune system that may make you more susceptible to developing shingles. People with medical conditions that may affect their immune system, like lymphoma, HIV, leukemia. Sometimes people taking immunosuppressive drugs or steroids, what they're doing is they're suppressing their immune system, and so they're weakening their immune system, and their immune system cannot fight off this dormant virus that is wanting to reactivate in their nervous system. Most people who develop shingles only have an episode in a lifetime, although you can have multiple episodes. And I do know of a few people in my family who they have had several episodes and or chronic, what they call chronic or long-term shingles. So the pain with shingles is usually described as an intense burning sensation. I don't know if you've ever had what they call maybe like a neuropathy. It's different from a pain in a muscle or an injury. It's this nerve pain. So a lot of times people will say that they'll describe it as this burning sensation under their skin. The pain can last for months or even years. Like I said, the rash may disappear, but the discomfort from the rash and the shingles virus can remain. There is a term for the long-lasting pain, which I referred to, and it's called post-herpetic neuralgia. So neuralgia is nerve pain, and post-herpetic is after experiencing that herpes zoster virus or after experiencing a bout of shingles. You may have this lingering post-herpetic neuralgia. It says it's the most common complication of shingles, and as you age, your risk for post-herpetic neuralgia can increase. So if you develop shingles, or if you think you've developed shingles, what are you going to do for treatment? Well, of course you're going to call your doctor. There are antiviral medications that can be prescribed to you, and you and your doctor can determine whether or not they're safe for you to take. And what they'll do is help the symptoms, help decrease the pain, and just make those symptoms of shingles milder than they would be without the antiviral medications. It can also shorten the course of your shingles. So if you were without the medication gonna say have it for 2 weeks, maybe taking an antiviral might shorten it to 5 to 7 days or something like that. At home you can use cool ice packs or cool cloths, and that will decrease pain that you may have, discomfort you may be experiencing. Calamine lotion, you know that lotion that comes in the pink bottle, that can help at times. It does have a topical analgesic in it or a topical pain medication, and you can apply that to the blisters. Now it does say here, do not pick at your blisters. I'm a picker. I wouldn't be good with shingles because the fluid inside the blister is contagious. So prior to, if you have a blister, if it doesn't break or pop, it's most likely not contagious. It's the actual fluid in the blister that is contagious. Once the blisters pop, dry up, and go away, that area is not going to be contagious. So like a dried up blister is not contagious. It's really that fluid, okay? But what you want to do is you want to wear loose clothing, and you want to try to keep your blisters covered, because although the shingles virus is less contagious than chickenpox, you can actually transmit chickenpox through blister fluid from shingles to someone who has not yet had the chickenpox. And if you've had most children are vaccinated, not everyone. They do have a chickenpox vaccine now. So most children are vaccinated, but if they haven't been, they could potentially, or an adult who's never had the chickenpox vaccine, they could potentially catch chickenpox from that. Another thing here is to avoid contact with pregnant women, immunosuppressed, and low birth weight infants. And again, you know, these are people who are at risk. You don't want this pregnant woman's baby or fetus to get anything. And immunosuppressed and low birth weight infants, they're at higher risk to catch it, and their immune systems are going to not be as strong as the average person to fight it off. So the only way to prevent shingles is by vaccination. The CDC recommends healthy people ages 50 and older to get 2 doses of the shingles vaccine. The name of the vaccine is Shingrix. It was FDA approved in 2017. Before Shingrix, people were given Zostavax. Is anyone familiar with Zostavax? Okay, so that vaccine, I believe, was approved in about 2006. This can be used for prevention in those in people over 60 years of age with allergies to the Shingrix vaccine, or if they need the vaccine right away and there's no access to Shingrix. Shingrix has, this will say on a later slide, Shingrix has shown to be more effective in preventing shingles and post-herpetic neuralgia. And so that's why Shingrix is like #1 choice. Although I'm not 100% sure on this answer, but I want to say it's just that studies have shown that people 50 and older are more susceptible to contracting or to having the shingles virus reactivate in their system after having chickenpox. And so it's just recommended for people over 50. I'm sure if you have a shingles outbreak and you're under 50, you'll be able to receive it, the vaccine. But again, that would be a discussion for someone to have with their physician if they're under 50 years of age and they feel like they're at risk. Shingrix will be given in 2 doses. The doses are usually 2 to 6 months apart. If it's been over 6 months since you received your first Shingrix dose, that's okay. Just get your second dose as soon as possible. You don't necessarily have to restart your series of 2. But again, that would depend on how long it's been since that 6-month mark, and that would be a discussion that you'd have with your physician. If you do ice packs, I would do ice or cool. Doesn't have to be frozen, and I wouldn't leave them on for more than 15 minutes at a time. You just want to kind of settle that area down without over irritating the nerve with the cold. But they do work quite well. Most people, the majority of people, are getting Shingrix now, and that is because it's more than 90% effective in preventing shingles and post-herpetic neuralgia, whereas Zostavax, it's usually used in people over 60. It reduced the risk by 51% and 67%. So as you can see, Shingrix is a much more effective medication to use in prevention. Protection with Shingrix remains above 85% effective for at least the first 4 years. So there's a question as to when do I get my next shingles vaccine? Okay, I've had it in 2023, now when do I get it again? And there's no definite answer. Again, it's something for you and your doctor to discuss. I want to say on average, I want to say I've heard 5 years, but that's not a definite, it's not a definite answer. You may develop a site reaction. It may or may not be extremely painful. It's usually typical for an injection site reaction where you would receive a vaccination. So you may have tenderness, you may have pain with movement, you may have some redness at the site, a little bit of swelling. And I want to say that can be managed just like you would with any other type of vaccination, where you can do a warm or a cold compress. You can take Tylenol or ibuprofen if that's something that you can take. So there are ways to manage those. But some people just, I get the flu shot every year, and some years I don't even feel it, and some years my shoulder is sore for a week. So really depends. Were you dehydrated that day? So there's all different factors that can feed into how your site reaction ends up.
Because I had both injections.
Probably not, but it's, you know, especially since they were on different arms. But it's just something where it's typical. Yeah. Okay. So who needs to get Shingrix? So Shingrix is recommended for healthy adults ages 50 and over. Definitely if you've had shingles in the past, you should receive the shingles vaccine. Even if you've received Zostavax, you could get Shingrix, although, and I think someone was talking about this, it says wait at least 8 weeks after Zostavax and then talk with your doctor about getting the shingles vaccine. If you're not sure if you've had the chickenpox, you can get the Shingrix vaccine. There's no maximum age and there's no specific time to wait after having shingles to get the vaccine, although the rash should be gone. So let's say you never get the Shingrix vaccine, you break out in shingles, and your doctor says, okay, well, you should start getting your Shingrix vaccine. You want to wait until at least the rash is completely gone. Okay? Okay, who should not get Shingrix? People with an allergic reaction to any component of the vaccine. That's not necessarily just the medication or the vaccine itself. It could be preservatives that are in the fluid in the syringe with the vaccine. You shouldn't get the Shingrix vaccine if you've tested negative for immunity to the varicella zoster virus, in which case get vaccine for chickenpox. So if you test negative for immunity to chickenpox, then they would recommend that you get the vaccine for chickenpox. You should not get the Shingrix vaccine if you currently have shingles. We just talked about that, if you still have that rash, okay? If you're breastfeeding or pregnant, obviously you don't want to pass anything on to the baby. And if you have a temperature of 101.3 or higher, and this is very typical with most vaccines, and think about it like this, your immune system is fighting really hard right now to work on whatever's causing this fever. You don't want to aggravate it anymore by giving your body a vaccine and having it have to shift its focus on over to the vaccine, okay? So wait until you're healthy. If you make an appointment for your Shingrix vaccine and then you wake up and you're not feeling so hot and you have a temperature, your best bet is to just reschedule that vaccine injection. So what are some of the side effects of Shingrix? So just like any vaccine, we just talked about this, you could have a sore arm, you could have some redness or swelling or tenderness to touch at the site. Some people would even report tiredness, shivering, similar to those symptoms that may come on before you break out with an actual shingles rash, that nausea, stomach pain, maybe even a low-grade fever. Some side effects are more common in young people, and that has to do with their immune system. So their immune system is going to be more sensitive to that, react a little bit stronger, and so they're more apt to get those side effects. Serious side effects or allergic reactions are very rare. It says here 1 to 2 people out of a million. It's a very small amount. But obviously call 911 if you develop any type of throat swelling, hives, trouble breathing, feeling like your throat is tightening up, difficulty breathing, weakness, dizziness, etc. And it says here that this particular vaccine does not contain thimerosal, which is a preservative that contains mercury. This has to do with your insurance. As far as payment for the Shingrix, for the shingles vaccine, Medicare Part D covers it, but there may be a cost depending on your plan. You may have a copay, you may get fully reimbursed or partially reimbursed. Like you might have to pay up front and then get reimbursed. Medicare Part B does not cover the Shingrix vaccine. Medicaid may or may not, depending on your plan. Private health insurance it says here many will cover, but you always want to check with your insurer. And I recommend that with anything, whether you have a private health insurance or whether you have any of the above. Always call and check with your health insurer before you receive any type of vaccine. You want to know what's to be expected as far as what am I paying and what's expected of me cost-wise. GlaxoSmithKline, which is the company that makes Shingrix, they do have a vaccine assistance program. I'm sure if you go on their website, they'd have information on that. So as far as the patient assistance program that GSK has, and again, that's the drug company that makes the Shingrix vaccine, the criteria for someone to be eligible would be that they have no third-party coverage for vaccines, or they'd be enrolled in a Medicare Part D prescription drug plan and have spent at least $600 on prescription medicines through their Medicare Part D prescription drug plan during the calendar year. And that's a calendar year, okay? They have to be an adult, 19 or older. And they have to live in one of the 50 states, District of Columbia or Puerto Rico. And they also have to not be eligible for Puerto Rico's government health plan, Mi Salud, or have applied and have been denied. So obviously, we're here, we're in the US, so this wouldn't really pertain to us. And there's household income criteria. Here are the monthly gross incomes for that, okay? For everyone, I don't know if you all heard, her friend he had shingles and then he developed this post-herpetic neuralgia, which is this long-term nerve pain, and which he's currently taking medication for. He can't take hot showers. Again, there are antiviral medications that can help decrease. Lyrica is more of, not so much an antiviral, but it helps with neuropathy or nerve pain.
Because he couldn't sleep.
Right.
Yeah. And
so
he
there.
got shots at the beginning. He got shots for the pain.
Yeah.
But,
so there are medications that can help, but I'm sure that he's discussed, he's talked with his doctor. I'm so sorry. Yeah, I'm sure it's not a fun thing to have to live with. And that's, there's a great example of, the importance of this vaccine. So, not to say that if he had gotten the vaccine, he wouldn't have developed the shingles, but it really does. It says it prevents it. There's an over, what did it say, 90% chance of preventative care as far as not developing shingles after having the chickenpox. With every medication, that disclaimer needs to be given to you as a consumer, because it's liability, right? So although the chances for you to be allergic to the components of whatever the vaccine is mixed with are very slim, it can happen. A lot of times people don't know whether or not they're allergic. It's something where if you did know, or if your doctor felt like it wasn't for you. I have a family member who has multiple allergies, and so she has to be very careful with vaccines because her doctor says you have so many allergies to so many things that you're more perceptible to be allergic to the stuff in the vaccine. Does that make sense? So let's look for an alternative for you. So it's really something where you don't know, and it's just a talk with your physician. For a full list of ingredients that are in the vaccine, you'd really have to go to what they call the package insert, or the prescribing information of the drug company of the actual medication, which you can find on the drug company's website. Yeah. And then if you wanted to, you could discuss those ingredients with your physician and then decide if it's safe for you to take. Well, thank you guys for coming out today. I really appreciate your time. I'd love to be able to do something like this again soon. So thank you. Thank you.